All right, so I had the question come up. How do you build confidence in nursing school, or how do you build confidence to get to nursing school? And I'll be completely honest with you. I stayed nervous the entire time I was in nursing school. I know I've shared before that I would literally projectile vomit during or right before or during a an exam during nursing school, and that's true. That's what I did. The one thing I did find, the one piece of advice I did find that could actually help you build confidence, or help you get your emotions right, is find you a peer. At the time I worked at a hospital, I was on a pretty hard unit, and the nurses that worked with me, they were really cool, and they would talk to me about their experiences during nursing school, and I would share with them how I was feeling during their school, and that really helped me. That really helped me finding somebody. They may or may not have been my age. Some of them were older, some of them were younger, but that really helped me. Probably the best is just talking to the nurses who had already done it. I remember I go to church with a lady who's a nursing school instructor, and I would talk to her about how I was feeling, while in school, and she would tell me how she felt while she was in school. Not necessarily on a teacher-student perspective, but how she felt, while she was actually in school, and how nervous and upset she would get during exams or just regular clinical. And so that is definitely the best way to help your confidence, in my opinion, is to find a peer, to find another nurse, and just get yourself acclimated with them, and get them to help you. Just talk to them. Just talk to another nurse. If you're in home health care, if you're a CNA in home health care, it may be a little bit harder for you. But if you're a CNA in any sort of setting, it is definitely easier to get a hold of a nurse. And probably the easiest way to get that conversation started, the easiest way to be able to communicate to a nurse, is at the beginning and end of each shift, a nurse is going what's called a report. And a report is where you talk to a nurse coming on or leaving, and you talk about each patient. You talk about changes. If you're in a nursing home or long-term care, report can be a little bit different than if you're in acute care, but there's still going to be a report given. And so if you're a CNA, or really anybody in the healthcare and you're in nursing school, ask a nurse that you feel comfortable with. Say, hey, can I go on report with you? And when you go on report with another nurse, you're going to hear things that you probably don't know the names of, or you probably don't understand. You may hear, VTAC, AFib. You may hear certain medications. You're like, oh, what is that medication for? Or, maybe it may even be a drip rate. Just something that you hear in that report, and with that nurse that you feel comfortable with, ask them, maybe not at that time, but ask them, hey, what was that? What was that AFib? What was that VTAC? What was that, what is this vancomycin? What is this clindamycin? Why does Miss 123 have an IV now in her left arm when it was in her right arm yesterday? And the nurse, if you're comfortable with them, they're going to go over policies. Well, we had to change the IV because it was 3 days old, or, they're on vancomycin now instead of clindamycin because that's what the physician felt due to the gram positive or negative, or, the VTAC is related to their heart rate going crazy. And these little bits of information that you'll get during report are ways for you to kind of ease yourself into a conversation with this nurse and say, hey, listen, nurse, I'm in school right now, and we're learning about VTAC, we're learning about vancomycin, we're learning about, whatever it may be. Can you help me more with school? And they maybe help you with how they studied. They may help you with how they coped with things. I know I've talked about how I would go into the library and blast Andrew WK and dance around like an idiot. You know, that was, you know, my coping or whatever. So the easiest thing to do is find a peer, find a nurse that you feel comfortable with, and just talk to them. And the easiest way to get into that conversation is go on report with them, because during report you're going to hear medical terms, or you may not even hear medical terms. Typically, I don't give medical terms. I give yucky. They feel yucky, wet. They sound wet. You know, things like that. But you know, you still may ask questions if you hear me give report. And I'm always pretty thorough, or at least I think I'm pretty thorough. So, if you need confidence in nursing, or if you need confidence in nursing school, find you a nurse, talk to them. You know, I'm not saying you have to set them down and have dinner with them, but you know, talk to them here or there. They will definitely help you. They'll definitely help you, you know, build that confidence up. And it helped me to hear other people say, yeah, I definitely had trouble with that. You know, when I was working in dialysis, my unit manager failed her renal exam in nursing school, you know, and of course I was already a nurse when she told me this, but I was like, wow, now you're a unit manager on a dialysis unit? Yeah, I mean, if someone was to hear her say that needed that at the time, you know, it would definitely help them. So I hope it helps. I hope you find you a nurse. I hope you find you somebody you can talk to about it. So that's my advice. Hope it helps. Thank you much.